Hi, I'm Dr. Sri. Some of you know me as wound doctor. I'm certified in clinical wound care. Before I go in details about wound and wound care, let me tell you a story. In 2013, how my journey in managing wounds started. In 2013, I was suddenly had fever. I was admitted in hospital, and then they diagnosed me to have necrotizing fasciitis. Necrotizing fasciitis is a severe infection, commonly known as flesh-eating bacteria. My right thigh was affected, and then I was taken to operating theatre, and then they found that it was quite badly infected, and then they approached my wife, counseled my wife, and asked her to give consent for amputation. But due to some complications in the OT, the surgery they didn't proceed with the surgery, and I was sent to ICU where I was recovered. I was recovering. And when I got up, I was surprised to see myself in ICU with relatives who I have not seen for many years standing beside me and assuring me that I'm okay. Being a doctor who has worked in ICU, of course I know when you see patients' relatives' face and they tell you something, you're okay, you're definitely not okay. They told me about the condition, the seriousness of the condition, and the probability that I need amputation. Necrotizing fasciitis, about 75% of patients who are infected with necrotizing fasciitis don't make it. 25% survive after the limb that was affected is amputated. My children that time, my children were very young, 7, 5 and 3. And being a doctor, I hardly had any time for my family. Hardly any family time. So I couldn't remember, if anything happened to me. When I look back, I'm not leaving any memories for my children. And that was very hurtful. If anything happens to me, what will my children remember me about? And probably they wake up in the morning, they don't see their father. They go back to sleep, they don't see their father. Most of the time weekends I'm on call. So all this was happening. Then I decided to go against medical advice, and I took a discharge and went home to spend some time with my children. The thought of amputation made me feel very depressed. And all the thing that was in my mind was the few days that I have, the small short time that I have, I want to spend with my children. If I'm going, I want to leave a small memory for my children to remember me. Then when I went home, spent time with the children every day, night when I go to sleep, I pray to God, give me just one more day, to spend time with my children. And I started managing my wound on my own, and then managed to heal. Then after that, I went back to work like normal. And some people say it's like a second life. God gives you second life for a reason. Second calling, they call it, I think. And then I started seeing patients with wounds in their leg. My perception before my illness and after my illness has changed. This time I understood the pain they go through, the depression they go through, the fear. Because everyone knows, of course you know that when you have a wound in your leg and you're diabetic, and eventually it ends up with amputation. So I took up these cases and managed to salvage the leg, managed to save them from amputation. The reputation preceded me, and more patients started coming. So it's time I realized I need to improve my knowledge, build my confidence. So I signed up for a certification course with the Malaysian Society of Wound Care Professionals. I went for training, courses, and got certified. My mentor was Dato Prof. Hari Krishna Nayan, who still is my mentor. I got my certification, and in this course I learned more about managing wounds. What we were doing 40 years ago and now there's a lot of difference. The wound management has advanced. There's a paradigm of shift in wound management. You need to know how to approach the wound, what type of dressing to use, in which type of wound. And there's a lot of advanced wound dressing materials available in the market now. This is to help the wound heal much more faster. By learning how to balance the moist, controlling infection, applying the right dressing is very important. And instead of letting the wound progress for a longer time, this advanced wound dressing helps heal faster. Some patients' perception and thought about this advanced wound is expensive, but in long term, it's not that expensive. Unlike normal dressing where you go for dressing every day, advanced wound dressing requires you to do dressing every alternate days, maybe 1 week 3 times. You don't have to do dressing every day. And the difference between conventional dressing and advanced wound dressing is conventional dressing might take you longer, and the risk of recurrent infection and higher risk of amputation is there. But in advanced wound dressing, the wound heals faster, the infection is better managed, and the risk of amputation is less. So with this, I managed to salvage many wounds from amputation. I got an opportunity to become a speaker in a global conference in KL. And last year, I was invited as a speaker for Commonwealth Wound Conference. And recently been recognized by British Media as one of the successful wound doctor in Malaysia. So what my advice is, if you have a wound that does not heal in 1 month, look for the right people who are certified and get properly treated. Okay? Don't have this misconception about the cost of the dressings. Okay? And then the most important is that you probably will save your leg from amputation. In future, I'll be doing more videos. I think some of you have already seen, I've already did some videos about wound dressings. In future, I'll be doing more. I'll be talking about more about wounds. Also, I'll be also talking about other medical issues, about wellness, preventive medicine, nutrition, lifestyle modifications. This is just the beginning of my video. I want to introduce myself. And if you like the video, please follow me, and see you back in the future. Thank you.